Welcome back, Straight Talkers. A common question that I'm asked by parents is, how do I know if my child is having a psychiatric emergency, and what should I do about it if they are? Today, we're going to talk about the signs and symptoms that need attention right away. In addition, I'm going to give you 2 phone numbers that you need to add to your child's phone right away in case they are experiencing a mental health crisis and you are not around. As parents, we all know that if our child breaks a bone, is having shortness of breath, or is having some sort of physical intense pain, we should take them to the emergency department to get checked out. However, it's not always clear what is considered an emergency when your child is dealing with big emotions, sticky thoughts, or problematic behaviors. This often leads to a lot of confusion and uncertainty because, as parents, our goal is to keep our child safe, and the idea of something bad happening to them is terrifying. So let's go over the top 3 reasons to bring your child into the emergency department for a mental health evaluation. Reason number 1 to bring your child in for evaluation is if they are at risk of harm to themselves. This includes the more obvious behaviors, such as them making a suicide attempt, saying in person or online that they want to kill themselves, or them self-harming with the intent to die. Other behaviors could include searching online about how to harm themselves or writing suicide notes. There are other more subtle signs to look out for as well. This includes your child taking steps to prepare to harm themselves, such as stockpiling pills or trying to obtain weapons. Or I've also seen kids start to give away their belongings or try to make a will. The second reason for an emergency evaluation is if your child is a harm to others. This includes saying in person or online that they want to harm a person or a large group of people. Threatening others with weapons or becoming more violent towards others are also reasons. Other signs to look out for would include destroying property, starting fires, or harming animals. Reason number 3 to have your child emergently evaluated is if they are having changes in the way they are behaving or changes in the way they are thinking. This includes them talking or acting strangely to the point where they're not making sense and it seems like they've lost touch with reality. Other things to look out for would be them hearing or seeing things that aren't really there or becoming overly suspicious and paranoid. All of these reasons require emergency evaluation due to them being life-threatening events. Now I want to share with you 2 phone numbers that I personally believe every parent needs to put in their child's phone right away in case your child is experiencing a mental health crisis and you're not around. Outside of the more obvious option of calling 911, there are other crisis numbers that kids and teens can utilize. The first number to add to your child's phone is the National Suicide Prevention Hotline. Their number is 1-800-273-TALK, and they're open 24/7. This is a national network of local crisis centers that provides free and confidential emotional support to people in a suicidal crisis or in emotional distress. The second number to add is the crisis text line. This is one of my favorites because a lot of kids these days don't like talking on the phone and would prefer to text someone instead. All your child has to do is text hello or home to 741-741 if you reside in the United States or Canada. This crisis text line provides 24/7 free support to anyone in any type of crisis. This just doesn't include those who are having suicidal thoughts. You can even utilize them if you're having big, painful emotions. They'll connect you with a crisis counselor who's a trained volunteer that can provide support. And the goal of any conversation is to get you into a calmer and safer place. They'll also provide you with a referral for further help if it's indicated. However, sometimes just having someone to be there and listen is helpful enough. If you have any topics that you'd like to hear more about, put your ideas in the comment section. Otherwise, head on over to the next video to find out more ways that you can help your child live their best life.